5 rural hospitals in Michigan are bracing for impact as massive federal Medicaid cuts start to take effect.
Last year, members of Congress voted to slash the Medicaid budget by $1 trillion over the next decade. Now hospital officials in Hillsdale are making a desperate plea for them to change their minds. News 10's Riley Connell shares their message.
We're talking about issues of life and death. This isn't any longer talking about politics or who's right on the left and who's right on the right. This is talking about human lives.
Hillsdale Hospital CEO J.J. Hodshire is asking Congress to reverse $1 trillion in cuts planned for Medicaid over the next decade. Supporters of that move say it will trim the fat of the federal budget and cut down on wasteful spending. But Hodshire says this puts patients and services at risk. Adam Carlson with the Michigan Health and Hospital Association adds, even with state efforts to fund the system, federal rollbacks will have a lasting impact.
As these cuts continue to deepen in the years going forward, there is not going to be enough resources to protect Medicaid at the state level.
$1 trillion federal Medicaid slash means roughly $6 million in annual losses for Hillsdale Hospital. Departments like pregnancy care and mental health are the first services to go when margins get thin. Hodshire says that's why advocacy matters now more than ever before.
When you look at what happens next, lift our voices up. And we have to do that respectfully. We do it in a forum where we're educating, where it's real statistics, and we're going to talk about the real faces that this impacts.
In Hillsdale, Riley Connell, News 10.
State budget negotiations are already underway. Preliminary budget recommendations from the State House of Representatives include an $800 million Medicaid boost to try to fill that federal gap.
A leader in the